Hi, my name is Olivia Alford. I'm the Director of the Delivery System Reform at the Office of Main Care Services. Welcome to the Primary Care Plus recorded orientation. Primary Care Plus launched on July 1st of 2022 with an exciting number of primary care practices enrolled. We had 228 practices spanning family practice, pediatrics, and internal medicine. And throughout this presentation, we will provide you more information about the Primary Care Plus program at a high level. It also will reference numerous links that you can find in the PDF copy of this presentation on the Main Care website. So in addition to the Primary Care Plus practices that I just mentioned, at the launch of Primary Care Plus, there were 218,000 Main Care members attributed through Primary Care Plus. And you'll see on this slide the breakdown of the population categories of Main Care members that became enrolled into Primary Care Plus. So it was a major initiative and one that we are very happy to see off the ground. In this brief PowerPoint today, we'll be going over the goals of the Primary Care Plus program, policy requirements, the attribution and reimbursement methodology, and future technical assistance opportunities for practices. The goals of Primary Care Plus include really making changes to the way that Main Care supports primary care practices so that they can deliver whole person, flexible, comprehensive primary care to Main Care members. Primary Care Plus was developed deliberately to align with the Centers for Medicare and Medicaid Innovation Primary Care First initiative, and Main Care is an officially aligned payer with CMMI on that front. Something that we're really looking forward to seeing is how Primary Care Plus can support meaningful practice change through this transition that we've gone through to changing to a value and population-based payment model for primary care practices. All of these changes, we hope, will improve health and healthcare outcomes for Main Care members. More specifically, Primary Care Plus gets us to a place where we can then move further and further away from the fee-for-service system towards alternative payment models, which we'll talk a little bit about. Primary Care Plus replaces three past primary care programs that Main Care used to support, and does take some pretty significant steps forward in setting us and the practices up for further payment transformation and care delivery transformation. Primary Care Plus is built on top of fee-for-service, but the payments that practices receive are population-based, risk and performance adjusted. Primary Care Plus rewards performance outcomes, and similarly as to Primary Care First and other DHHS efforts, picks a small set of measures that are aligned with high priority items across the state and that you might see in other payer models around primary care. Data sharing is a critical part of Primary Care Plus, and practices will receive attributed member lists and performance data quarterly once we're up and running. And a critical piece of Primary Care Plus is just how the department and how the Office of Main Care Services is able to partner and collaborate with primary care practices around this initiative and all the corresponding pieces to make sure that we really are working together to drive healthcare outcomes and cost-efficient use of healthcare resources. So this is really an ongoing partnership between participating practices, stakeholders that are interested in working with practices and with Main Care, and with community partners who again can all come together to support true transformation of care and outcomes for Main Care members. Primary Care Plus, at the time of this recording, we're going to talk a little bit about how it aligns with Main Care's efforts to incent high-value care through transitions to alternative payment models. Main Care has a goal of having 40% of Main Care payments tied to value by the end of 2022. We have been making good progress on this goal over the last few years, and maybe by the time you're watching this, we actually will have surpassed the goal. The next section, we'll just briefly go over some of the policy requirements for Primary Care Plus. Everything that we're talking about today can essentially be found in the Main Care Benefits Manual section of policy for Primary Care Plus, which is Main Care Benefits Manual, Chapter 6, Section 3, Primary Care Plus. And that really is your best source of information about what's currently required in the program. how do you know what documentation requirements there are, reimbursement methodology, and who is eligible to participate in the program. Additionally, there will be an operational and methodology guide available on our website, which we'll reference throughout this presentation. So the service expectations of Primary Care Plus are in orange on the slide here, and we won't go through them all today, but I'll leave this slide up, or you can pause the recording to see that each service expectation was selected based on relevance to primary care and really what reflects high quality primary care as is commonly accepted through literature. And then also what service expectations should be in place considering other changes that the main care program or DHHS has made to support some of these specific areas of importance to the main care population. For example, I'll just say that, on the first bullet that we want to make sure that we emphasize that blood testing is required in the Primary Care Plus program for pediatric populations, which is also a state law. So just reinforcing existing expectations through this program. And then many other examples here give Department of Health and Human Services, DHHS, initiatives that can support practices in being successful in Primary Care Plus. There's also a few mentions here of main care coverage, reimbursement for corollary or related services that support the work of Primary Care Plus providers. So while we are requiring Primary Care Plus providers here to offer or refer to advanced care planning and palliative care consultations, we on the fee-for-service side do cover advanced care planning, billing, and we are developing a palliative care service with stakeholders. Similarly, with dental and oral health integration into primary care, we've made sure that while we are requiring primary care providers to play their role in oral health needs of main care members, that we also have reformed our dental benefit for broader dental coverage for adults and children in main care. This next slide is another set of Primary Care Plus service expectations that are, again, standard of practice for primary care, but just reinforcing them through this model. As you're going through this webinar, if you have any questions about how to meet these service expectations or how to do the best job you can at understanding and sharing information about these service expectations with your team and your staff, then you can reach out to us at the email address at the end of this webinar to request technical assistance or learn about how to connect to other resources. Another critical part of Primary Care Plus, aside from service expectations, is the expectations that come with the practice tier that each primary care practice enrolled in PCPlus falls into. So all practices within Primary Care Plus at least qualify for base level requirements. They have 24/7 coverage for when someone needs to reach someone in the practice at any time of the day. They have certified EHR, they participate in technical assistance, and they complete annually a behavioral and physical health integration assessment and address an area that they can improve upon from those results. Lastly, all Primary Care Plus practices educate members about primary care versus urgent care versus emergency department use to help navigate the healthcare system. And then if practices seek to become an intermediate level PCPlus practice, they have to meet all the criteria in the middle column here. I won't go through them all, but essentially there's heightened requirements here. Many of these come with primary care medical home accreditation, but also might be things that are specific to how the main care program operates, other services that can support primary care, other things of importance to our population and many populations regarding behavioral health services and working with community-based organizations or community health workers as an example. And lastly, for those practices that want to reach the advanced tier, they also can meet the requirements in the final column to the right. And these practices must also be part of a main care accountable communities program, which is the main care ACO model. As you move up in tier levels, each primary care practice is eligible for greater reimbursement under PCPlus as you move up into these tiers. And we'll talk about reimbursement and how that comes through to practices shortly. So as of the initial launch of Primary Care Plus, the majority of practices, well, I should say the largest portion of practices fall into the advanced tier, which is great to see. And then it goes down from there. Next, the intermediate tier has 35% of practices, and the base tier has 27% of practices. And each year, practices will have an opportunity to move up or down, if that was the case, in their tier level. So you have an opportunity to change tier based on how your practice grows and develops. The next section is about attribution and reimbursement, and we'll keep this somewhat high level. So under Primary Care First, what we're talking about in this webinar is really the first launch of Primary Care First, the phase 1 of Primary Care First. And in phase 1, primary care fee-for-service, as is depicted in the orange circle, still exists. So all practices continue to bill fee-for-service or with their prospective payment system or all-inclusive rate as they always have. What PCPlus does is it integrates all of our primary care, all of our programs that used to exist around primary care into population-based payments that come on top of fee-for-service. So these population-based payments are risk and performance adjusted. And again, the amount of these population-based payments changes based on which tier of primary care the primary care practice falls into. Those together equal total primary care payment. And in the future of Primary Care Plus, we'll see this diagram shift a little bit as we move away from fee-for-service as the primary means of reimbursement. So how are Primary Care Plus rates set? Again, we're talking about the blue circle. We're talking about how we come up with the population-based payment amounts. So the two really major inputs, or three major inputs, are population and risk adjustment, the practice characteristics, which are the tiers that we just talked about, and then the red circle symbolizes the performance-based adjustment on top of that. The starting point for all of this is attribution and member attribution process. So Primary Care Plus looks at a 24-month look-back period to review primary care service utilization by main care members. Then we look at the service utilization to select the primary care practice where a member received the plurality of their primary care claims. We're looking at the service location level to see, again, which primary care practice did the member receive the plurality of services within that 24-month look-back period. We do this analysis every quarter and update attribution lists. Main care members may opt out of their the PCPlus program as a whole, or may change who they were attributed through this claims-based process by contacting main care member services. There is no opportunity under Primary Care Plus for providers to make changes to attribution because, again, we are doing this as a claims-based process primarily, and looking to really emphasize that this is a population-based payment program. So while it is possible that members have moved to different locations or a claims-based process isn't capturing the most, what someone might say is the most recent information, it is data-driven and it does reflect an accurate population-based payment methodology. So once we have the attribution list for each practice, we're able to come up with the population and risk adjusted per member per month payments. So the population for each practice gets distributed among the population groups of children, adults, age-blind, disabled, and duals, and whether the person's risk score qualifies them to be generally well or complex. So we do this essentially at the practice level every quarter. We'll take the list and the list of individuals will be distributed into these 8 rate cells. And from the combination, the weighted average essentially of where the practice population falls within these groups, we'll come up with a practice-wide per member per month that's used for attribution used for all attributed members throughout the year. If a practice has a major shift in their population that they want to report to main care and request a change to their population and risk adjusted per member per month, they can reach out to request that. And that would be something like a merger or additional service line being added to their primary care practice. These distributions and how main care has established essentially the cutoff between generally well and complex risk scores is based on us looking at the data for the whole main care population and setting thresholds so that then each practice can really receive payment that's commensurate with the actual composition of their practice. Last part of payment, so we talked about this first part, population risk adjustment. The practice level, as you know, comes from the tier assignments that we showed in the previous section. The last part we'll talk briefly about is how we adjust for performance quarterly. So this webinar today isn't going to go into a ton of detail on this because for the whole first year of Primary Care Plus, the practice level per member per month is not adjusted for performance, as we are starting to just get the data in and share the data out with you. Instead, for the first year of Primary Care Plus, every practice receives a 53-cent upward adjustment per member per month in lieu of performance-based adjustment. Beginning in July of 2023, the practice level PMPM portion of the monthly rate will be adjusted every quarter for performance. And the PMPM can be decreased by 10% or increased by 25%. And it's just that practice level portion of the PMPM that can have that impact from the performance-based adjustment. There will be a separate webinar covering the performance-based adjustment methodology once we have the data to share with practices and go over some example calculations. In the meantime, here is a list of the Primary Care Plus quality measures, including a demonstration. You'll see how acute hospitalization accounts for 30% of the potential performance-based adjustment by itself. In other words, it's more heavily weighted than all the other 8 comprehensive care domain measures, which will be part of Primary Care Plus over time. Performance-based adjustments include adjustments for both how achievement and improvement. Achievement is how well a practice performs relative to their main care peer group, which is a group of Primary Care Plus practices that have similar characteristics to them. And also how well each practice performs relative to themselves in a previous period. So putting that all together as far as a schedule and how the reimbursement goes on a schedule, every year practices have an opportunity and a requirement to recertify that they meet Primary Care Plus tier requirements. And that, again, if it's a new practice, they can apply to be in Primary Care Plus and see which tier they fall into. That establishes your practice level. Every year, main care analyzes practice data to look at the population and risk adjusted per member per month. Every quarter, main care attributes members to Primary Care Plus practices, looking at a rolling 24-month look-back period. And then every quarter, starting next year, July 2023, OMS implements the results of the performance-based adjustment on the quarterly per member per month. However, OMS main care pays these payments monthly to practices for attributed members. There's a separate webinar that is recorded on the website to learn a little bit more about the reports and the available supports around finding information about your reimbursement through the Health Pass portal. And here is a visual depiction of what we just covered. So again, every quarter, new attribution begins. And then every about third week of the month, participating providers receive payment reports and payments related to the Primary Care Plus program. And then once a year, it will be around the springtime. Practices are able to apply as new practices or recertify that they still meet or meet a different tier level than they had previously. Next, I will hand it over to Loretta.
Hello, my name is Loretta Dutel, and I am the Operations Manager for the Delivery System Reform Unit here at MainCare Services. And I will be providing you an overview of the technical assistance that we will be offering. So here's an overview of the different types of technical assistance that will be provided. We will be providing ongoing support to practices. This includes regularly scheduled orientations and, of course, as needed training requested by practices to discuss things like PCPlus policy requirements, troubleshooting specific issues or questions, or other supports needed by practices. We will also have peer learning opportunities available to collaborate with other practices to share lessons learned around service delivery expectations and just other supports and resources that may be needed. We've also collaborated with external partners, DHHS offices and agencies, and other resources that can provide learning opportunities for practices. We will be planning on offering regular open office hours that will be informal meetings, but we will allow practices time to ask questions that they have. And we also plan on being available for that full hour for questions. So practices can feel free to join the meeting at any time during that hour to ask a question. Finally, we do expect to have a calendar available on our website in the fall that will provide you with an overview of learning opportunities, including dates, times, and how to join in on these opportunities. Our primary way of communicating with PCPlus practices will be through our e-message system. This will be the best way to get PCPlus updates and notifications. To sign up is easy. You will need to go to the link on this page and enter your email address. And once that is entered, you will be brought to the next screen where you can select your subscription. So there are a number of different subscriptions that you can sign up for. However, we will be sharing all PCPlus updates through the MainCare, Primary Care, and Case Coordination subscription. So you will need to select that as one of your subscriptions, although you are more than welcome to select any others that you're interested in at this time as well. Once you have selected your subscription and clicked on submit, you will get a message indicating that you have subscribed, and you will also immediately receive an email noting the subscription that you have signed up for. And then going forward, you will begin receiving notifications that are posted in the subscription. Finally, if you have any questions about PCPlus, feel free to email us at this email address. This goes to our general email box that is reviewed and responded to regularly, so you can connect with any one of us on our team. So thank you very much for taking the time to review this webinar, and we hope that this has been helpful for you to understand more about PCPlus. Please do not hesitate to contact us with any questions, and thank you, and have a great rest of your day.